Okay, today we're going to discuss all about the renal diseases. So we divide our renal diseases or damage in our kidney could either be as your glomerular disorder, tubular, or could also have the interstitial. So wherever the damage is, then that's the classification of our renal disease. Again, if the damage is basically on the glomerulus, then that's glomerular disorder. If the damage affects the tubular function, it becomes tubular disorder. And if the damage, for example, in the interstitial part, then become interstitial disorder. Okay, first we discuss glomerular disorders. So again, your damage in your glomerulus may be in the form of immune complex disorder. So most likely, majority of our glomerular damage because of the deposition of your antigen and antibody complex within our glomerulus. And the damage is because of the activation of the different cells that would try to remove your antigen and antibody complex that has been deposited in our glomerular membrane. So basically that one is due to your activation of your complement, lymphocyte, neutrophil, macrophages. As these cells here try to remove your antigen-antibody complex, they try also to damage. Since naka-attach ang ating antigen-antibody complex in your glomerulus, it eventually also try to damage your glomerulus. And thus would affect the function of your glomerulus, making that one as your glomerulonephritis. Okay, then another one, you could also be related here to non-immunologic disorder. Glomerular disorder may be caused here by some condition that the patient has been exposed to the toxic substances. It may be your toxin or even your chemicals which try to damage your kidney. Your glomerulus specifically that become here your non-immune mediated. Okay, so the damage in your kidney may be in the form of your cellular infiltration, cellular proliferation that would allow the thickening of your glomerular basement membrane. Okay, and what happens here once your glomerulus membrane become thickened, so kakapal siya, so pag kumapal siya, it will hinder also the function of your glomerulus when it's with its filtering capacity. Okay, so we have here your glomerulonephritis. So again, this is just your sterile inflammatory process that try to affect our glomerulus or just simply your inflammation of your glomerulus. Okay, so for all disorder related to your glomerulonephritis, then we have here the basic laboratory manifestation or what have been found in the result of the laboratory urinalysis of the patient. So meron siyang hematuria. Pag sabing hematuria, that's the presence of your blood, the RBC, in the urine sample. Then could also have proteinuria because again, na-damage ng ating kidney, lumalabas dumadaan ng ating protein because normally dapat if you have a normal glomerulus dapat it will prevent or it will not allow your protein bound substances to be filtered. But since na-damage mo ang ating glomerulus, so ang kanyang filtering capacity affected na and it will just allow your protein to pass through. And therefore, what you have here would be your proteinuria. And of course, gas will be present that will signify that you have problem with your kidney, especially on the upper area of your kidney. Okay, the first one, example of your glomerulonephritis, we have your acute post-streptococcal glomerulonephritis. This is an acute glomerulonephritis or your AGN that's related to your infection as a consequence, as a complication of your usual na mga sore throat infection or the upper respiratory tract infection. And because of that, later on, it tried to damage your glomerulus again because of the formation of your antigen-antibody complex. Okay, so it's being caused here by your strep infection in form of your strep pyogenes. Okay, so prominent manifestation, we have fever, edema orbitals so around the eyes, namamanas ang patient natin. We have here also your hypertension, oliguria. Most likely affected ng ating HCN are children. So rare ito na nangyayari sa mga adult patient because this one is just an acute na glomerulonephritis. Pag acute na, so bago pa lang, so young children. Kung chronic na siya, so we are expecting that your population is adult population because pag chronic, di ba, matagal. So, alam nga naman matagal. Okay? Hindi naman magiging matagal ang condition kung bata pang patient natin. Di bago pa lang. And therefore, you are, parang ganun ang rationale niya. So, just have common here among the young children. Okay, so laboratory tests still have the presence of hematuria, proteinuria, oliguria. Oliguria is the decrease na urine output because of your damage, your kidney function. And of course, the presence of your RBC. So, may dugo ang urine patient natin. So, pag lalaki ang patient natin, pag batang patient natin na lalaki, so, always na yun magiging pinaka main mo na diagnosis or first choice mo na diagnosis. Pag let's say magpa-consult ang patient, tapos may signs symptoms, magsabi na may dugong hinya, so most likely it's just related to your glomerulonephritis. That's your acute post-streptococcal glomerulonephritis at namamanas dito, the orbital area. Another one, increased BUN and creatinine. BUN and creatinine are your analyzed for assessment of your kidney function. So since damage ang kidney natin, so BUN and creatinine, which are your kidney function tests, also increase abnormal. Then we have here positive for us, so anti-streptolysin O. So it's because again, the patient has been affected by your strep pyogenes and their streptolysin O is immunogenic, try to produce an antibody. And that's antibody na produce mo because of the infection, mag-attach doon sa ating antigen, which is your strep pyogenes sa bacteria, ang kanyang toxin na streptolysin O. So magproduce sila ng antigen-antibody complex that will be deposited in your glomerulus. Tatanggalin ni complement ang ating antigen-antibody complex. Pag tinanggal niya, pati ang glomerulus mo where your antigen-antibody has been deposited will eventually try to cause damage in your glomerulus. And that results to your AGN post-strep related to your strep pyogenes infection. Okay, the next type of your glomerulonephritis, we have your rapidly progressive glomerulonephritis or your crescentic. Okay, your rapidly progressive glomerulonephritis is just a consequence of your other glomerulonephritis which try to develop here to become your rapidly progressive, or it might be also the consequence of your autoimmune or immune complex disorders. Diba yung nangalanan siya, tinawag siyang crescentic because the damage in your glomerulus parang crescent, pag ano siya, crescent moon, di ba? So, pag ganon, half moon, crescent. So, parang pag ganon ang kanyang damage. Okay, the damage on that is basically the damage on that is because of your macrophages, which try to accumulate in your bone space and then eventually try to cause damage on that as your macrophages try to release here your plasma cells and plasma and even your cells. Secrete cell and plasma, which eventually also try to further damage this one to form a crescentic formation. And if you try to examine this lesion or damage, this crescentic formation na damage is made up of the different cells. It's made up of the combination of your macrophages, polymerized fibrin, that could also have made up of your fibroblasts. On the next one, we have your Goodpasture syndrome. Goodpasture syndrome is an autoantibody or autoimmune disorder. Pag sinabing autoimmune disorder, your own cell is being attacked by your own antibody. You're producing autoantibody wherein you are attacking your own cell in your body because normally dapat your antibody, okay, dapat hindi ito do not try to react on our own cell in our body because it's normal, it's not a foreign antigen. But what happens in the autoimmune disorder, you are producing autoreactive na mga cells na nagre-react sa sarili nating cell, which is dapat hindi niya ginagawa. The Goodpasture syndrome is characterized by the presence of your autoantibody in the form of your anti-glomerular basement membrane. It's anti-basement membrane. Anti-glomerular, so this one is directed towards your kidney. Anti-glomerulus. Sa glomerulus siya sa glomerular cell natin siya nag-react and try to cause damage on that. Another one is anti-alveolar basement membrane. So this type, ang kanyang activity is directed towards your pulmonary alveolar of your lungs. So, dalawa ang kanyang dinadamage. One is your kidney, the other one is your lungs. Okay, manifestation of the lung or pulmonary problem or damage is meron siyang hemoptysis or you are spitting sputum na may blood. Then we have also dyspnea. And for the kidney, then the classic na may proteinuria ka, mayroon kang hematuria, then you have the presence of the gas. Okay, another one na autoimmune disorder, we have here your Wegener granulomatosis. Again, this one produces an autoantibody in the form of your ANCA. ANCA stands for anti-neutrophilic cytoplasmic antibody. So that one is from the words of anti-neutrophilic. That one is directed towards your neutrophil found in your small blood vessels in your kidney glomerulus and also in your lungs. So pareho sila ng activity. Only that kanina your good pasture, hindi siya sa neutrophil makikita. Hindi doon ang kanyang activity. But rather on the membrane ng glomerulus saka membrane ng lungs natin. Ito naman, ang inaatake niya, this autoantibody try to attack here the neutrophil found in your kidney or even in your lungs. Okay, so this one, okay, so that's your Wegener's granulomatosis. Another one, Henoxion lane purpura. Henoxion lane purpura, pag purpura, always may red spots, rashes, the purpura na tinatawag. So, Henoxion lane purpura is basically an immune complex manifestation following your viral infection, upper respiratory tract infection, very common among young children. And then again, meron siyang gastrointestinal tract pulmonary manifestation which try to damage your lungs or kidney, characterized by the presence of the blood in the sputum or even the blood in your stool sample. Gastrointestinal tract, so you have your blood in the stool, pulmonary, you have blood in your sputum. Okay, that's your rashes, red small spots on the skin. That's your Henoxion lane purpura. Okay, now we go to your membranous glomerulonephritis. So, membranous glomerulonephritis is just the thickening of your glomerular membrane. And basically because of, number one, the position of your immune complex in the form of your IgG, immune complex. In this immune complex, IgG here, usually being formed because of your immune disorders. Example of that immune disorders includes your systemic lupus, erythematosus, your Sjogren's, your secondary syphilis. It could also have here your hepatitis. So the first one, we have your membranoproliferative glomerulonephritis. It's just again alteration in the cellularity of the normal na glomerular membrane. Okay, there are two types of that, the type 1 and type 2. So the type 1 is basically because of the increased cellularity resulting to your thickening of your glomerular membrane. Okay, and that's primarily increased cellularity here in the subendothelial mesangium of your Bowman's capsule that would eventually resulting to your thickening of your membrane. Okay, pag hindi siya na-treat, hayaan mo lang and eventually, mangyayari niyan at the end, it will become here, try to progress to become your nephrotic syndrome, which is much severe disorder will have a severe manifestation as this. The second one, we have your type 2. The type 2 here is just nagkaroon siya ng alteration by dense deposit of your membrane with your immune complex. That would also try to alter the cellularity. Okay, the type 2, if left untreated, could progress here to become your chronic glomerulonephritis. Okay, so ang mga kidney diseases natin or renal diseases, they try to progress from one disorder to another. Usually, mga benign na mga disorder, if you just left it untreated, hayaan mo lang, ang mangyayari niyan, it will eventually, at the end, magiging ano siya, pag hindi mo siya na-treat, ang mangyayari niyan, it will progress to become here a severe form of your kidney problem. Okay, now we have here your chronic glomerulonephritis. So, kanina acute, this one is chronic. Pag chronic siya, so mean to say that one would have a longer duration, pabalik-balik, hindi siya natitreat. And that would be characterized here by worsening condition, manifestation of the fever, fatigue, anemia, hypertension, oliguria, and we have also your edema. Okay, and basically what you have here would be the presence of the classic na proteinuria, hematuria, and even glucosuria because na-damage na ang ating renal tubules, including its ability to reabsorb even your glucose. Hindi niya kaya reabsorb, and therefore your glucose will be present in the urine of the patient. Another one, so it will also affect your glomerular filtration capacity of our glomerulus, therefore decreasing the glomerular filtration rate. Then we have also here increased BU and creatinine, signifying that you have problem in your kidney. And we have also here resulting to your electrolyte imbalance. Because most of our electrolytes is being regulated by our kidneys. If you have damaged your kidney already, so hindi mo na siya ma-regulate like maintaining that one na ito ay mataas dapat, like your potassium, so something like that. Then resulting here to your electrolyte imbalance. Okay, then we have also here your IgA nephropathy. Other name for that is your Berger's disease. So from the word itself, what's immune complex being deposited here in the glomerulus would eventually be the IgA immune complex. So again, this is still very common among young children following your respiratory infection. Okay, and this is characterized here by an episodic macroscopic hematuria. Okay, so my blood, the presence sa urine of patient, and even a patient could go asymptomatic here up to 20 years. So, wala siya masyadong signs symptoms. However, pag hindi siya talaga na bigyan ng pansin, hindi siya talaga na fully treated, kahit parang feeling mo walang signs symptom ng patient, ang mangyari niyan, this disease here still progressing to become chronic glomerulonephritis or even your nephrotic syndrome or even your end-stage renal disease. So, kahit feeling mo na wala na siyang sakit kasi wala siyang signs symptoms, not unless you try to perform the urinalysis every now and then. So, makikita mo may blood sa patient, sa urine ni patient. Okay, and then it's only time na you need to fully treat the patient. Pero pag hindi mo siya makita, or hindi ka ganun ka very, strict with testing or pag-consult sa physician, so mangyari niya, feeling mo wala ka ng sakit but eventually, ang pangit sa kanya, still progress to your more complicated, more severe na infection or disorder, could progress eventually to your end-stage renal disease, magugulat ka na lang, or even your chronic glomerulonephritis. Okay, the next one we have here your nephrotic syndrome. Nephrotic syndrome characterized by marked proteinuria, madami kang excrete na protein that could go high as more than 3 grams per day. Di ba normal lang natin hanggang 10 mg per dl or that's more than 10 mg per dl. Tama ba? Okay, sa kanya more than 3.5 grams per day. So sobrang dami niya na talaga. Okay, so this is also characterized by the decreased albumin concentration with high fat production or high lipid production. Okay, the problem with your nephrotic syndrome here because of the changes in the electrical charges in your podocytes of your glomerular membrane that would try to disrupt here the tightly fitted na mga podocytes which are responsible for the filtration. With that, ang mangyari ay lumalaki ang butas ng ating mga podocytes, okay, that serve as our barrier, di ba, that would inhibit or restrict your substances which are big molecules to pass through. Since na-damage na ang anyang filtration capacity, sobrang laki na ng butas, ang mangyari niyan, lumalabas ang mga substances natin from your blood, then eventually pass out to your urine. Okay, so example of that na lumalabas, so we have here your protein, amino acid, primarily in the form of your albumin. Ang mangyayari kasi pag we are losing your albumin, so that will be accompanied here by accumulation of your water to your interstitial space. So pag madaming water sa interstitial space, namamanas ang patient. And therefore, that's become your edema. Okay, another one, this will also trigger your liver to produce much of the lipids. Kaya sobrang dami ng lipids ng patient natin. And aside from that, your protein na lumalabas din from your blood going to your urine and eventually being put into waste na lang ang ating mga coagulation factors. Coagulation factors are needed in our body in order for you to have the the clotting process in order for you to stop the bleeding. So pag madami kang coagulation factors ang nawala, so you are prone to bleeding manifestation. Okay, we have here what you see under the microscope if the patient would have here the nephrotic syndrome. So since madami kang fats, okay, because of the too much production of your liver with your fats, then expect to have your oval fat bodies sa urine ni patient plus meron siyang fat droplets. Another one, the presence of your RTE. Then we have also the different cas, your granular, your waxy, or even your fatty na cas. Okay, the next one, we have your minimal change disease. So from the word itself, minimal, so this is a type of disease wherein you have just only a small damage in your glomerular basement membrane. So kahit konti lang ang damage, hindi yung ganun kalaki, but then still try to disrupt the normal, tightly fitted na podocyte natin. So medyo lumalaki din ang butas natin ng ating glomerulus with your minimal change disease. Okay, so this minimal change disease here may be related to the following recent immunization, we have also allergic reaction, or even the presence of a human leukocyte antigen B12. Again, those are the predisposing factor that would eventually result to your minimal change disease. Okay, the next one, we have your focal segmental glomerulosclerosis. Focal, segmental, so mean to say, focal is focus, mean to say one part lang, or segment, one part lang ng, or area ng glomerulus natin ang damage. The other part, if you try to look at that one, they are still normal. Okay, so since certain part lang ang damage natin become here focal segmental. Okay, so this also accompanied also here by the damage because of your deposition of your IgM antibody or immunoglobulin plus your C3, which is your complement component. Okay, focal segmental glomerulosclerosis is also being associated here with analgesic and heroin abuse among AIDS patients. And then we have also here the Alport syndrome. Alport syndrome is sex-linked recessive. Sabing sex-linked, so the female carrier natin ng abnormal gene, ang nagmamanifest ng sakit ay lalaking anak. Okay, so that's why very common na to sa ating mga male na patient. Okay, so your Alport syndrome here is characterized by the presence of your macroscopic hematuria plus your microscopic hematuria even before the age of 6. And later on, magiging itong complication niya. Magkakaroon siya ng eye defect, visual defect, and also able to have your loss. A tendency, we're going to lose here his hearing or even the visual or the eye. Magkaroon siya ng eye defects saka hearing defects. Okay, so we have the description of your glomerulus with your Alports is lamellated membrane with areas of filling. Okay, that's your Alport being a sex-linked recessive disorder.